Ozempic doesn't burn fat. It doesn't flush sugar out of your blood. What it actually does is hijack one of your body's own hormonal control systems and hold it in the on position almost permanently. That's why it works, and that's also why, for a lot of people, stopping it undoes almost everything. But before we get to that, because most people taking this drug have never been told what actually happens when they stop, you need to understand what Ozempic is actually doing inside the body. Because once you see the mechanism, the weight loss, the side effects, and the long-term picture all make complete sense. Let's start with the basics because they matter here. Every time you eat carbohydrates, they get broken down into glucose, which enters your bloodstream. As blood glucose rises, your pancreas detects that and releases insulin. Insulin acts like a key. It unlocks cells so glucose can move from the bloodstream into tissues, where it gets used for energy or stored for later. At the same time, insulin tells the liver to stop producing new glucose. Blood sugar rises, insulin responds, levels come back down. That's the healthy cycle. In type 2 diabetes, that cycle breaks in two places at once. First, body tissues become resistant to insulin. The key stops fitting the lock properly, so glucose can't enter cells efficiently. Second, the pancreas often can't produce enough insulin to compensate. The result is glucose building up in the bloodstream, and chronically elevated blood sugar over years damages blood vessels, nerves, kidneys, and more. High glucose levels react with proteins and fats in blood vessel walls, causing them to stiffen and narrow over time. This is what drives the complications: nerve damage, kidney failure, vision loss, and cardiovascular disease that make type 2 diabetes so serious long term. But here's something most people don't realize. Insulin isn't the only system controlling this. Your digestive system has its own set of hormonal signals, and one of them is where Ozempic comes in. When you eat, your intestine releases a hormone called GLP-1, glucagon-like peptide 1. GLP-1 coordinates several things at once. It stimulates insulin release, but only when glucose is already elevated, which matters for safety reasons we'll come back to. It suppresses glucagon, a hormone produced by the pancreas that does the opposite of insulin, signaling the liver to release stored glucose into the blood. When glucagon is overactive, blood sugar becomes harder to control. By suppressing it, GLP-1 helps keep that balance in check. It slows gastric emptying, meaning food leaves the stomach more gradually, so glucose enters the bloodstream in a slower, more manageable wave. And it signals the brain that you're full. One hormone. Four mechanisms, all working together to manage what happens after a meal. The problem is that natural GLP-1 lasts about 2 minutes in your bloodstream before enzymes break it down. It's a brief signal, enough to do its job in a healthy system, but not enough to be used as a treatment. That's the gap Ozempic was designed to fill. Ozempic contains semaglutide, a synthetic molecule engineered to mimic GLP-1, but resists the enzymes that normally break it down. Natural GLP-1 lasts 2 minutes. Semaglutide lasts approximately 1 week. That's not a small difference. That means the fullness signal, the insulin stimulus, the glucagon suppression, the slower gastric emptying, all of it stays active at a sustained level around the clock. Your body's post-meal hormonal response stretched across 7 days and held in place by a single weekly injection. And because the insulin-stimulating effect only activates when blood glucose is already elevated, the risk of hypoglycemia, dangerously low blood sugar, is significantly lower than with older diabetes medications that push insulin regardless of glucose levels. The drug is, in that sense, self-limiting. It amplifies a system that already knows when to switch on and off. The weight loss isn't a side effect. It's a direct consequence of the same mechanism. GLP-1 receptors exist throughout the brain, including in regions that regulate hunger and reward. When semaglutide activates those receptors continuously, appetite decreases, often significantly. Food cravings diminish. The urge to eat between meals drops, and because the stomach is emptying more slowly, meals feel satisfying for longer. Most people don't consciously diet, they just find they're not hungry. Portion sizes shrink naturally. Calorie intake drops, And over weeks and months, that sustained deficit produces substantial weight loss, without the constant mental effort of traditional dieting. This is why Ozempic felt like a revelation when the weight loss data came in. It wasn't that it worked better than willpower, it was that it changed the underlying biology that willpower was fighting against. The most common side effects are nausea, vomiting, diarrhea, constipation, and abdominal discomfort. For some people, these are mild and temporary. For others, they're significant enough to stop treatment. But they're not random. They follow directly from the mechanism. When gastric emptying slows, the stomach stays stretched for longer after a meal. The signals your stomach sends to the brain, which normally produce a sense of fullness, can become intense enough to register as nausea or trigger vomiting. Meanwhile, slower movement through the intestines disrupts normal bowel patterns. In some people, that means constipation because contents are moving too slowly. In others, changes in intestinal coordination produce diarrhea and cramping. GLP-1 signaling also directly influences the gut-brain connection to the vomiting center, which is why nausea is especially common early in treatment, and why doses are started low and increased gradually. These symptoms usually improve as the body adapts, but they explain why the first few weeks on Ozempic can be genuinely uncomfortable. There are rarer but more serious risks worth knowing. Pancreatitis has been reported, though a direct causal link isn't fully established. Gallstones are more common, particularly during rapid weight loss. When fat breaks down quickly, extra cholesterol enters bile, and a stomach that's emptying less frequently gives bile more time to sit, concentrate, and crystallize. Here's where the picture gets more complicated, and where most people taking Ozempic have been underinformed. When you lose weight on semaglutide, not all of it is fat. A meaningful portion of the weight lost, studies suggest potentially 25 to 40% in some cases, is lean muscle mass. That matters more than most people realize. Muscle is metabolically active tissue. It burns calories at rest, supports insulin sensitivity, and underpins long-term metabolic health. Losing a significant amount of it doesn't just affect how you look. It reduces your resting metabolic rate, meaning your body burns fewer calories even when you're doing nothing. This is not unique to Ozempic. Caloric restriction in general tends to cause some muscle loss, but the speed and scale of weight loss on semaglutide can accelerate it. And unlike fat, muscle doesn't come back on its own. Rebuilding it requires deliberate resistance training and adequate protein. Two things that aren't typically part of the conversation when someone is prescribed a weekly injection. And that brings us to what happens when people stop. When semaglutide leaves the system, GLP-1 stimulation drops. Appetite returns, often sharply, often within weeks. The fullness signals that had been artificially sustained disappear. And without the underlying biology having changed, eating patterns tend to return toward baseline. The weight regain data is stark. Studies following patients after stopping semaglutide show that the majority regain most of the lost weight within a year. Not some of it, most of it. But here's the compounding problem. If a significant portion of what was lost was muscle rather than fat, the body composition people return to isn't quite the same as where they started. They may weigh the same as before, but with less muscle and more fat. A composition that's metabolically worse, not better. Ozempic does not reset metabolism. It does not eliminate the biological drivers of appetite. It manages them continuously for as long as it's taken. For many people, that means this isn't a course of treatment with a defined endpoint. It's closer to a lifelong medication, like a blood pressure drug or a statin, that needs to be maintained indefinitely to preserve its effects. That's not a reason not to take it for people who need it. The benefits in type 2 diabetes management are real and well documented, but it's information people deserve to have when they start. So here's the full picture. Ozempic works by mimicking GLP-1, a hormone your body already produces, and holding it active for a week at a time. That sustained signal improves blood sugar control, reduces appetite, and produces meaningful weight loss. The mechanism is elegant and the effects are real, but the weight lost isn't purely fat. The drug works only as long as you take it. And stopping it without significant lifestyle changes already in place tends to return most of what was lost, sometimes to a body that's metabolically worse than before. That's not a scandal, it's biology, and understanding it is the difference between using this drug well and being blindsided by what comes after. If this gave you a clearer picture of what's actually happening, consider subscribing. It helps the channel grow and lets us keep making content like this. And if you want to keep going, check out our other videos. We break down exactly how medications and the body work in minutes.